To discuss the state of medical facilities and the internally displaced Syrians who are visiting these centers, we're joined by Dr. Mohammad Abrash, who is the medical director of Idlib Central Hospital. What is the #1 medical emergency in Idlib right now, doctor?
Okay, actually we are facing here in Idlib the many civilian injured patients, especially after airstrikes here in Idlib, so that we are staying here in this hospital underground, and we're facing a lot of patients. We have many patients here because the Idlib area became very crowded area. If you can see, we have a lot of patients. Somebody is coming with acute abdomen, somebody come with gunshots, somebody will come with need ICU patient and critical patient, especially after airstrikes. We are facing a lot of problems here, but we're facing the problem of shortening of beds. You can see this area is very small area. We cannot occupy all our patients coming here.
Let's give our viewers an idea of where we are. We are in an underground facility. Now, these hospitals were made underground because Russian airstrikes were destroying medical facilities and schools. So people like Dr. Abrash here and others were able to move the hospitals and emergency rooms like this one. For our viewers, if we can just...
We have one bed, 2, 3, 4, and 2 other beds here, only 6 beds, and we are facing daily maybe thousands of patients coming to this area.
1,000 patients?
Maybe 1,000 or around 800 or 1,000 patients daily coming to emergency room. And then we have here the doctor, an emergency doctor. He will check the patient and then refer to other specialties like general surgery. Like me, I'm general surgeon. To neurosurgery also, to ENT surgery, we are to vascular surgery. We have all these specialties here, and we are selecting the patient and doing operations inside.
Tell us about the internally displaced IDPs. Has that put pressure on the medical health infrastructure in Idlib?
Of course, it's putting a lot of pressure on us. We cannot serve all these patients. Okay. We are only few doctors here working alone. We need more helps. We need more medication. We need more facilities to accommodate all these patients.
You've been here for a few years now. How has the situation in the past couple of months changed?
Now, after this airstrike stop for a few months, really, we are facing a lot of patients, more of patients, because the patient before, when there is a strikes, all the patients are distributed in the areas away from here. Now all the patient is crowded and accumulate in Idlib city. Okay, so any illness, any patient has any illness, he will come here. So this one, it will put also us on pressure.
Doctor, you're talking about urgent need of medicine. Where is most of the medicine coming from into Idlib? Because on one side you have the regime, then you've got Afrin on the other, so there's no way for medication to come in except the Turkish border.
Only Turkish border is the one way we are collecting this medication, and it will come by donation. Somebody will donate this for us and give it to us. So donation is not enough for us, so that we have shortage of medication.
Doctor, we can't emphasize enough that there are a lot of people here, there's a lot of commotion here. What more needs to be done here?
Also, we have shortage of OR rooms also and supplies for OR operation, what we need to do, like orthopedic operations or general surgery operations or neurosurgery operation. And even our OR, if you see, our door is a curtain. We don't have door to close the OR.
You're holding it with these curtains on the side.
Yes, we are holding that. And you will see our equipment is very old.
Actually, let's show
it's very old. And here you see we have a lot of work here inside. We have 5 OR rooms and all are busy. Daily we are doing maybe 30 to 40 operations.
How many doctors in the OR?
Yeah. In the OR we have, actually I told you, general surgeon, neurosurgeon, ENT surgeon, and orthopedic surgeon, and vascular surgeon. 5 doctors. We have 5 rooms.
What is the most common thing that these people are treating here, the doctors?
We are treating the orthopedic cases, General surgery cases, this is the most, and the third is neurosurgery patients. Yani, like example, gunshot in the brain. I am treating anything in the abdomen. Gunshot is the abdomen, acute appendicitis, for example, intestinal obstruction, something like this.
So a lot of gunshot wounds.
There is a lot of gunshot wounds. And for orthopedic, for actually
Even now when the situation is relatively
yeah, there is some bombs. It's coming from the remaining bombs from the regime. Sometimes the children will play with it and it will blast on them, so that it will injure them. And we have many cases like this came to us.
Dr. Abrash, thank you so much.